So hello everyone. Our today's topic of discussion is all about the general pathology images. In this video, we are going to discuss about the general pathology images which are frequently asked in various kind of exams. So basically, our first pathology image that is shown on the screen, that is our Barrett's esophagus. Barrett's esophagus. So basically, what is our Barrett's esophagus? Basically, Barrett esophagus is an example of the metaplasia, in which the one type of differentiated epithelium is get converted into the another type of epithelium. In this case, in Barrett's esophagus, the normal epithelium we see is that stratified squamous non-keratinized epithelium. So stratified squamous non-keratinized epithelium. So what happen in this case that our stratified squamous non-keratinized epithelium that get converted into our columnar epithelium with glands, and this condition is in response to the GERD. That is a stressful condition for our Barrett's esophagus. So in this diagram we can see that is our glands. That is our glands which are basically found in the columnar epithelium. This is our stratified squamous non-keratinized epithelium. Or basically we can see in this area the epithelium get converted into the columnar epithelium. So in this case we have seen about the normal structure of our Barrett esophagus pathology image. So basically what is our metaplasia? Let's see about it. Metaplasia. So basically, our metaplasia is the conversion of one type of the epithelium or connective tissue to another type of epithelium and connective tissue. In this condition, the gastroesophageal reflux disease, the GERD, is the stress for our epithelium, and this kind and basically metaplasia is a type of cell adaptation. Cell adaptation. So what we have seen until now that Barrett's esophagus is a type of the metaplasia in which one type of epithelium get converted into the another type of epithelium, and this is a type of the protective measure against the GERD. So let's move forward. Our next image is the coagulative necrosis. Coagulative necrosis. So in the screen you can see there is a coagulative necrosis in which we can see pale wedge-shaped infarct. So coagulative necrosis of our liver. In liver we can see the coagulative necrosis. Basically coagulative necrosis is found. Coagulative necrosis is found in all type of solid organ except brain infarct. In all solid organ infarct. So basically, every type of solid organ infarct include the coagulative necrosis except our brain infarct. Solid organ necrosis. Except our brain infarct, which basically shows which type of necrosis? Very good. Liquefactive necrosis. Except brain. Let's we move further ahead. That is our diagram of liquefactive necrosis in our brain. What I have said about it. This is our liquefactive necrosis. Hope you got my point. So basically this is our liquefactive necrosis in our brain. So brain show liquefactive necrosis. Our brain basically shows liquefactive necrosis. Apart from the brain, there is a fungal infection like histoplasmosis. Histoplasmosis. Histoplasmosis also show the liquefactive type of necrosis. Next diagram is shown on the screen. That is our लंग मेन केजियस या फिर यू बोले कि जो चीजियस नेक्रोसिस, डायग्राम शोन इज द केजियस नेक्रोसिस. So basically caseous necrosis is seen mainly in the infection of TB. So basically TB infection lung show the caseous type of necrosis, which is the white cheesy material as shown in the diagram. This is white cheesy material deposited in the tuberculosis infection in our lung. Next type of diagram is shown, that is our fat necrosis. Fat necrosis. So, what is our fat necrosis? Basically, fat necrosis is found in our pancreatitis, and other kind of disease. If we can say example like omentum, and next is a peripancreatic area, peripancreatic tissue. So basically, all these conditions shows mainly fat type of necrosis. In our last diagram, we can see the other type of necrosis, that is known as fibrinoid necrosis. So this is our fibrinoid necrosis. Fibrinoid necrosis basically seen in the vessel wall. Fibrinoid necrosis. This is our fibrinoid necrosis. Fibrinoid necrosis. So fibrinoid necrosis basically seen in which conditions? This is a type 2 hypersensitivity reaction. Type 2 hypersensitivity reaction. So in this diagram, we can see about the fibrinoid necrosis, in which the vessel lumen is being obstructed by the fibrinoid type of necrosis. So this was all about our necrosis and basic pathology measures. Hope guys you will like this, and in next video we will discuss about the more basic pathology images which are frequently asked in any kind of exam. So thank you so much guys. Like, share and subscribe.